What is honey? Honey is a sweet, viscous food substance made by bees and some related insects. Bees produce honey from the sugary secretions of plants or from secretions of other insects, by regurgitation, enzymatic activity, and water evaporation. Honey is commonly used as a sweetener. It's made up of 70 to 80% sugar, the rest is water, minerals, and protein. Honey contains some nutrients. Honey is a sweet, thick liquid made by honeybees. The bees collect sugar, mainly the sugar-rich nectar of flowers, from their environment. Once inside the beehive, they repeatedly consume, digest, and regurgitate the nectar. The end product is honey, a liquid that serves as stored food for bees. The smell, color, and taste depend on the types of flowers visited. Nutritionally, 1 tablespoon of honey, 21 grams, contains 64 calories and 17 grams of sugar, including fructose, glucose, maltose, and sucrose. It contains virtually no fiber, fat or protein. It also contains trace amounts, under 1% of the RDI, of several vitamins and minerals, but you would have to eat many pounds to fulfill your daily requirements. Where honey shines is in its content of bioactive plant compounds and antioxidants. Darker types tend to be even higher in these compounds than lighter types. Uses for honey. Burns. Honey has been used as a salve to heal burns and prevent infections for thousands of years, according to the Mayo Clinic. Results also show that honey may reduce burn healing time. Memory. Some say honey can improve both short and long-term memory, especially in menopausal and postmenopausal women. In one study, trusted source, postmenopausal women who were given 2-aling honey treatments for several weeks saw as much improvement in their immediate memory as women are given hormone therapy of estrogen and progestin. Herpes. Research conducted in Dubai shows that honey is an effective topical treatment for both oral and genital herpes. Honey can heal lesions from herpes just as quickly as ointments you find at a pharmacy, and it's even better at reducing itchiness. Diabetes. Honey has a lower glycemic index than sugar, which means it won't spike your blood sugar levels the way sugar will. Honey also has a sweeter taste than sugar and may help you use less sweetener on foods. Cancer. Honey is celebrated for its antioxidant properties, which causes many to wonder if it can help prevent or treat cancer. A 2011 study from Iran looked at how honey affects renal cell carcinoma, a type of kidney cancer. Hemorrhoids. Hemorrhoids cause itching and pain in the anus, as well as blood in the stool. They are never fun. If you're looking for a home remedy, honey might fit the bill. A pilot study using a mixture of honey, olive oil, and beeswax as a topical treatment found that the mixture significantly reduced pain and itching, as well as bleeding. Wounds and ulcers. Honey has been used to dress wounds for centuries, but does it work better than gels and compresses? The research is mixed, but certainly not against honey. The Mayo Clinic says that honey can sterilize wounds and promote healing, and also reduce pain, odor, and wound size. It can also treat antibiotic-resistant bacteria and long-term ulcers and wounds after surgery and from burns. Fertility. Honey has been lauded for its potential to boost fertility in both men and women, but the evidence is mixed. 2 separate studies using rats, conducted in Nigeria in 2013, give very different results. Psoriasis. Psoriasis is a common skin condition that causes redness, blisters, itching, and even lesions. It's usually treated with topical creams that contain corticosteroids or vitamin D, but honey may be more effective. Honey can have some surprising uses. With a low glycemic index, it's a good substitute for sugar and can help you monitor blood sugar. But if you want to use it medically, like applying it topically to wounds and irritated skin, make sure you speak to your doctor. It's also used to alleviate allergies. But honey has many other uses. Surprisingly, many of the conditions that honey is used to treat are far more serious than the simple sore throat. When you have a sore throat or a cough, honey is one of the best, and tastiest, salves nature has to offer. Modern science is finding evidence for many of the historical uses of honey. These are healing wounds and burns. People have consumed honey for thousands of years for its supposed health benefits. There have been some cases in which people have reported positive effects of using honey in treating wounds. A review published in the Cochrane Library indicated that honey might be able to help heal burns. The lead author of the study said that topical honey is cheaper than other interventions, notably oral antibiotics, which are often used and may have other deleterious side effects. However, there is a lack of evidence to fully support this claim. In fact, a study published in the Lancet Infectious Diseases concluded that applying medical-grade honey to the wounds of patients has no advantage over normal antibiotics among patients undergoing dialysis. Honey should never be given to young infants as it can cause botulism, a rare but severe type of food poisoning. Reducing the duration of diarrhea. According to research-based reviews on honey, it has been shown to decrease the severity and duration of diarrhea. Honey also promotes increased potassium and water intake, which is particularly helpful when experiencing diarrhea. Research that took place in Lagos, Nigeria suggests that honey has also shown the ability to block the actions of pathogens that commonly cause diarrhea. Preventing acid reflux. Recent research has shown that honey can reduce the upward flow of stomach acid and undigested food by lining the esophagus and stomach. This has helped to reduce the risk of gastroesophageal reflux disease (GERD). GERD can cause inflammation, acid reflux, and heartburn. Fighting infections. In 2010, scientists from the Academic Medical Center at the University of Amsterdam reported in FASEB journal that honey's ability to kill bacteria lies in a protein called DEFENSIN1. A more recent study in the European Journal of Clinical Microbiology and Infectious Diseases showed that a certain type of honey, called Manuka honey, can help prevent the bacteria Clostridium difficile from settling in the body. C. difficile is known for causing severe diarrhea and sickness. Some studies have revealed that Manuka honey may even be effective for the treatment of MRSA infections. Dr. Jenkins concluded, Manuka and other honey have been known to have wound healing and antibacterial properties for some time. But the way in which they act is still not known. If we can discover exactly how Manuka honey inhibits MRSA, it could be used more frequently as a first-line treatment for infections with bacteria that are resistant to many currently available antibiotics. Manuka honey may even help reverse bacterial resistance to antibiotics, according to research presented in the journal Letters in Applied Microbiology. This type of honey showed action against Urea plasma ureolyticum, a bacteria that is resistant to many different antibiotics. A study published in the journal Pediatrics, which compared honey to placebo in helping children with a cough during the night, found that honey was superior. The researchers concluded, parents rated the honey products higher than the psyllium date extract for symptomatic relief of their children's nocturnal cough and sleep difficulty due to URI, upper respiratory infection. Honey may be a preferable treatment for cough and sleep difficulty associated with childhood URI. In the Scientific World Journal, researchers provided data confirming that natural honey was as effective as a solo antiseptic solution in reducing wound infections. There is a great deal of evidence supporting the use of honey as a remedy for infection. Relieving cold and cough symptoms. Honey may prove beneficial in relieving symptoms of a cold or cough. The World Health Organization, WHO, recommends honey as a natural cough remedy. The American Academy of Pediatrics also recognizes honey as a treatment for a cough. However, they advise that honey is not suitable for children under the age of 1 year. A 2007 study by Penn State College of Medicine suggested that honey reduced nighttime coughing and improved sleep quality in children with upper respiratory infection to a greater degree than the cough medicine dextromethorphan. Replacing added sugar in the diet. Honey's sweet flavor makes it an ideal substitute for sugar in the diet. Added sugar in the diet provides excess calories with no nutritional benefit. This can lead to increased body weight, which comes with an increased risk of high blood pressure and diabetes. Honey can be added to food and beverages to sweeten the taste without the negative health impact of added sugars. However, since honey is still a sweetener, it is important to remain mindful of how much honey being is used. Medicinal use of honey. Honey has been used to treat a wide array of illnesses, ailments, and injuries. It can be mixed with other remedies and consumed or rubbed onto the skin. Practitioners of Ayurvedic medicine have attempted to use honey as a remedy for the following: stress, weakness, sleep disturbance, vision problems, bad breath, teething pain, cough, and asthma, hiccups, stomach ulcers, diarrhea and dysentery, vomiting, bedwetting and frequent urination, high blood pressure, obesity, jaundice, hangover relief, eczema and dermatitis, burns, cuts, and wounds, arthritis. While not all uses of honey are confirmed as effective, trying it as treatment will not make conditions any worse or cause harm. Honey is sometimes touted as a cosmetic solution for cracked, dry, pimply, or clogged skin. We learn that honey contains a number of antioxidants, including phenolic compounds like flavonoids. Honey is less bad than sugar for diabetics. The evidence on honey and diabetes is mixed. On one hand, it can reduce several risk factors for heart disease common in people with type 2 diabetes. For example, it may lower bad LDL cholesterol, triglycerides and inflammation while raising good HDL cholesterol. However, some studies have found that it can also increase blood sugar levels, just not as much as refined sugar. While honey may be slightly better than refined sugar for people with diabetes, it should still be consumed with caution. The antioxidants in it can help lower blood pressure. Blood pressure is an important risk factor for heart disease, and honey may help lower it. This is because it contains antioxidant compounds that have been linked to lower blood pressure. Studies in both rats and humans have shown modest reductions in blood pressure from consuming honey. Honey also helps improve cholesterol. High LDL cholesterol levels are a strong risk factor for heart disease. This type of cholesterol plays a major role in atherosclerosis, the fatty buildup in your arteries that can lead to heart attacks and strokes. Interestingly, several studies show that honey may improve your cholesterol levels. In fact, people with diabetes may do best by minimizing all high-carb foods. Keep in mind, too, that certain types of honey may be adulterated with plain syrup. Although honey adulteration is illegal in most countries, it remains a widespread problem. And also, honey should only be consumed in moderation, as it is still high in calories and sugar. The benefits of honey are most pronounced when it is replacing another, unhealthier sweetener. At the end of the day, honey is simply a less bad sweetener than sugar and high fructose corn syrup.